Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 415,182 confirmed cases of COVID-19 in Canada and 127,309 cases in Ontario. Chatham-Kent has 519 cases and Sarnia-Lambton has reported 427 cases. Michigan now has 394,036 cases, with 21,663 cases being in Detroit. Today, we are reporting 66 new cases of COVID-19 in Windsor and Essex County. Of the 66 cases, 10 are close contacts of confirmed cases, 1 is a local healthcare worker, and 55 are still being investigated. We have had 4,054 cases since March. 3,470 cases are now resolved, and 501 cases are active and being followed by our health unit. 34 people are currently in the hospital and 8 people are in ICU. Our community has lost 83 people to COVID. 56 deaths have occurred among residents in long-term care and retirement homes. There are currently 21 active outbreaks in Windsor and Essex County. 6 in long-term care and retirement homes, 9 workplaces are in outbreak, 3 schools, 1 community outbreak, and 2 hospitals remain in outbreak. A team of 17 provincial offences officers conducted a COVID-19 workplace safety campaign on December 4th and 5th in Windsor-Essex. The weekend campaign included officers from the following ministries and agencies: the Ministry of the Environment, Conservation and Parks, Ministry of Labour, Training and Skills Development, Ministry of Transportation, Ministry of Finance, Alcohol and Gaming Corporation of Ontario. The officers visited approximately 240 workplaces and found in preliminary reporting that nearly 80% were in compliance with public health requirements under the Reopening Ontario Act. A range of compliance actions were taken, including compliance assistance, tickets, warnings, and referrals. As discussed with our health unit, the campaign focused on the retail sectors, including big box stores in the Windsor and Leamington area. Restaurants were also visited throughout the campaign. The top areas needing improvement in Windsor-Essex were screening, physical distancing, and having safety plans in place. Please do your part to prevent the spread of COVID-19. Stay home if you are sick. Limit close contacts to your household. Keep a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering indoors. Outdoors if physical distancing cannot be maintained or if wearing a mask is required. Avoid touching your eyes, nose, and mouth with unwashed hands. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Testing for COVID is available by appointment at selected pharmacies and assessment centres. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex will have a 3rd assessment centre beginning tomorrow at Windsor Regional Hospital Met Campus. Testing is available at Windsor Regional Hospital Olette Campus, Erie Shores Healthcare in Leamington, and Sohack in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. Over the weekend, we reported 128 cases on Saturday and Sunday. Today, we are reporting 66 new cases. Windsor-Essex moved to red zone last week, and since we moved to red zone on November 30th, in the last 7 days, we reported a total of 425 cases. Despite the restrictions from orange and now in red zone, our case counts are not changing, and based on that data, our case rates are comparable to the areas that are in lockdown. We talked about the healthcare system capacity getting overwhelmed with the rapidly increasing cases last week. And just to give you more in context, it took us 81 days to reach the first 1,000 cases. We raced from 1,000 to 2,000 cases in just 45 days after. And then it took us 114 days to add the next 1,000 cases in our area, meaning we did really well to move from cases counts of 2,000 to 3,000. But then our cases increased at a rapid rate, and it only took us 25 days to cross the 4,000 mark. While we are getting assistance from the province to support our case and contacts in the region, we need your support to follow the public health measures and help us do the case and contact management by self-monitoring your symptoms every day. Limit number of your close contacts. Ideally, do not meet anyone unless for reasons such as providing support to select few who need it and cannot do it on their own. And just a reminder that gathering limit for any indoor gathering in red zone is 5 people only and not 10. Restricting all non-essential visits. Physical distancing at all times with anyone who do not live with you. And develop a plan in case any of your family member is diagnosed with COVID or exhibits symptoms suggestive of COVID. Think about an isolation plan, work plans, grocery plans, and any other needs that you may have to get to when you are sick. Try and maintain a diary of all activities that you are doing, including a list of all individuals you are meeting to help public health identify possible source of acquisition and identify high-risk contacts for containing the disease and prevent any further transmission. Prepare a plan to notify your close contact based on your diary of activities and list of all high-risk close contacts. If any of you develop a symptom or identified as a close contact or is a confirmed case, do not wait for public health to get in touch with you. Please implement isolation plans for your family immediately. Someone will get in touch with you as soon as possible to give you instructions on how to self-isolate properly, but a detailed interview will happen in the next few days. If you're having any symptoms and if you haven't got tested, go and get yourself tested immediately and seek healthcare support as needed. Even while waiting for test results, avoid all high-risk settings as best as possible. When a case is confirmed, notify all close contact, including workplace, school, others, while waiting for public health to complete their investigation. This is a difficult time for all of us, and every decision we make has an impact that not only affects us, but it also affects our family members and our community in general. The cases continues to increase, and even though this is a season where we are meeting and connecting with our family members, but this is not the time to be complacent. It also poses risk for more spread if we continue to have those those social gatherings in and around. We have investigated a number of clusters in the past that involves family gatherings. We'll continue to get some of these cases reports to us where there is a connection to a family gathering or an event. Please follow the public health measures before we get to the point where we cannot meet the ever increasing number of cases and do the case and contact management as we like to say to contain the spread of the disease. We need your support. Please follow those public health measures and follow the guidelines. Thank you.
We'll now take questions from the media. Today we'll start with AM 800.
Dr. Ahmed, with the number of people in hospital, 34, and with 8 of those in ICU, has there been any discussion to reopen the field hospital?
So we do not have any discussion on the field hospital, recognizing that the field hospital is not necessarily meant to provide care, acute care services. It was meant to provide any immediate urgent need of these patients, but the cases are increasing, and we are in conversation with the hospital to contain their outbreak as quickly as possible to allow admissions in the floor. So that conversation is ongoing, and we are hoping that that would alleviate some of this pressure, but at this time we haven't started talking about the field hospital.
You mentioned how obviously we're in red right now, but our numbers are showing we could be in the lockdown status. But just with the numbers provincially over the weekend, yesterday, I believe it was record-breaking yesterday, the areas that are having the larger number of cases are currently locked down. do you think the lockdown is in those areas is making a difference?
Absolutely. I think what we are always forgetting is the exponential spread. And if we take that factor into consideration, the exponential spread of these cases is what increase. And if we don't have those measures in place, then the increase could be much higher. As we have always said that you know, on an average, when we are tracking down our number of close contacts, and in fact, I did look at the data. I don't have that. Maybe I can present it some other time. The average number of close contacts that we are seeing in Windsor-Essex, we did pretty good in September, October, but then starting November, our average number of close contacts increased significantly compared to the province. And essentially that means when more and more people are having cases with the number of close contacts they have, the likelihood of all these close contacts contracting the virus is pretty high. And then when you have those high number of close contacts, they will continue to spread it to others. And this is what we're concerned about, that you know, we can have some of those measures in place, but we need your support. If we as individuals, if I as an individual am not taking the responsibility of taking care of myself and taking care of my own community, it doesn't matter whatever restrictions we put in place, we will never get there. The idea of these restricted measures is to send out a clear message. We have heard it from many times from people. You know, people get confused. We don't know whether we should do this or whether we should do that. The message has been clear. It cannot be more clear than that. We are in the red zone. We are risking a lockdown in the region. We need everyone's support, and all these measures, if we let's just say don't put any of these measures thinking that these measures are not working, our case count will be compared to anywhere else. And we don't even have to, you know, we have a great example of some of the other countries where they didn't put some of these control measures, and look at where they are. We are also seeing some challenges even within Canada, with some of the provinces are now showing record number of cases, and their case counts and their population doesn't really add up. It doesn't match. So we have been doing well. I think we just need to do more. And as much as it is challenging, I get that. It is not easy. And we're asking a lot of people many things. And all these measures, following all these measures, it's not easy. But we get that. We all need to be following those at least for a short period of time more. We know that the vaccine already started to roll out in England, and it is supposed to start shortly in US, and we have been in contact with our province as well for the vaccine. So the end is near. We just need to hold on to what we have right now and still protect all our vulnerable in our population and protect our community.
That's it for now. Thank you.
Any questions from CBC?
Hi, yes, good morning. Just as a follow-up to the question about lockdown, given that you are saying that our case counts are comparable to lockdown regions, is it time for Windsor-Essex to move into a lockdown this week?
Well, that's a good question, and I think the numbers do justify that. And we wanted to make sure that we are giving all the opportunity for everyone to start following those measures and to bring those case counts to a number which can be manageable given the size of our community and our unique challenges. But the numbers, what we are seeing right now, it's concerning, and it's adding a lot of pressure everywhere in everything that we are doing, all the way from public health to acute care to the testing and to the labs. There's an overall pressure in the entire system with the number of tests that are going in, the delays in test results getting back to us, and case and contact management. So I think we definitely need to look into it of what needs to be done to ensure the safety and well-being of our community.
I also just want to ask about the number of cases under investigation continues to be such a huge portion of the overall cases. And I'm wondering if you're seeing any difference yet with the new staff members that you've onboarded in terms of your ability to do more contact tracing, or is it you're just still really stretched thin?
So on the weekend, we typically have a little less staff, but this weekend actually we made quite good progress with our cases and our contacts. So we're not by no means up to date and current, but we do have a system in place, and we're using all of the resources that we have to try to be efficient with our communication to the cases and also to the high-risk contacts. So we did make some progress, and hopefully this week, with even more people, working and on board, we will continue to make progress. But Dr. Ahmed's comments today and the preparation for people that are awaiting to hear from us is what we really need from our community right now to stay isolated pending further information from our health unit, and to make sure your high-risk contacts are also isolating.
Thank you.
Any questions from Blackburn?
Just this morning, you talked about the measure over the weekend, the workplace safety campaign. I don't know if I missed it. Did you say specifically how many charges were laid over the campaign?
I have not talked about the charges. We received a preliminary kind of overview, and I think that'll be coming. And I also want to add that this campaign was in conjunction with our bylaw officers in the City of Windsor, the municipality of Leamington, and our own health unit enforcement officers. So I can speak for our health unit enforcement officers. They laid 3 charges this past weekend, but for the overall campaign, the numbers are not, they haven't been released yet, but we do know that they did approximately 240, visits.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning. Teresa, you said that over the weekend, your case management and contact tracers were able to make good progress, but with the case counts so high, we had 80 in one day, do you think that your staff will ever be able to fully catch up if they stay as high as they are right now?
Well, I'm never going to say never, but we keep working as hard as we can and making sure that we are using our resources as efficiently as we can, knowing that people, if they're just new to the program, they need to be able to actually be oriented properly. The case interview is not just a simple task. It is time consuming, and you need to be pretty familiar with using the software system, but also having those proper interview tools. So I would say that we have a system right now that is trying to contact the people that are getting their results, the positive results, telling them to stay isolated till they hear from us. And meanwhile, our case investigators are working on those that have been waiting to hear from us, and they're working on the opposite end to try to conduct those very thorough interviews. So we are not caught up. I want to just keep putting as many resources as we can into this task, and try to continue to work as hard as we can for our community. But the community has to do their part and really adhere to the public health measures, because the numbers continue to be very, very high.
Okay, thank you. And then separately, Doctor, you mentioned that you have been in contact with the province about the vaccine. Can you expand more on what those conversations, as preliminary as they may have been, what are those conversations like? What are you learning about the vaccine?
Well, I'll start, but Teresa's also engaged in some of these conversations, but most of these conversations are around the logistics of how we will receive the vaccine, how we will store the vaccine, and what's our ability to to operationalize all those details. So there was a number of preliminary conversations around that, and a lot of those conversations we've been asked to keep it confidential in terms of some of the specific logistical issues. But we are working with them. There's a number of avenues that we are talking about. So one is the operational sides of it, and then obviously there's been talk about the approval process, how the vaccine is currently being looked at by Health Canada in terms of the approval process. What does it mean from the National Advisory Committee on Immunization, who provides their recommendation to Health Canada, and then the priority group who will get the vaccine, who this vaccine is indicated for. So there are a number of candidate vaccine that we are reviewing, or the Health Canada is reviewing right now. And the expectation is a lot of those approval process may come in this week. And once it's out there, I think then the more details would be the actual arrival of the vaccine and the distribution of the vaccine that would require much more detailed logistical challenges. But it's a massive undertaking by any means, and we do feel that there will be many players involved because of the timing of it. And a lot is dependent on the delivery. If we get the vaccines, we do have lots of processes in place. We have done mass immunizations many times, so we do have that ability. We do have a lot of the logistics that we need to put in place for the actual delivery of the vaccine from the staffing perspective, obviously depending on which vaccines we're getting. So there are a number of conversations that's happening. I don't know, Teresa, if you have anything more to add, and she's nodding her head. No, I think that's everything.
Okay, and I don't know if you're able to share this information, but with the health unit staff being as strained as they are right now, will the health unit be administering the vaccine, or will you be more organizational, facilitating, and maybe another party's administration of the vaccine?
So I think this would be premature to answer that question because, again, if for some reason we were given 200,000 doses just arriving 2 days from now or 3 days from now, and then how do we deliver it? It's different versus if we are getting the information, you're getting 10,000 batches of vaccine, and then it's prioritized only to the long-term care home residents or the healthcare workers at this time. And then how do you prioritize it? So I think it does require those details before we know. As I said, the expectation is because it's a massive undertaking, there will be many players involved, not only public health. There may be a role for primary care, there may be a role for the hospitals, and for some of the CHC, the family health team. So there may be many players involved just because of the sheer number of vaccine that needs to be distributed and vaccinated in the region. So I can't say at this time that how much of our own staff will be actually administering the vaccine. So it really depends on the supplies, but we are ready. I think our staff, we do have the ability to do that. We've done it many times with other vaccination campaigns. So I don't think that this is something that we cannot do. And again, it would just be the balance, what we are trying to achieve, and I'm sure Teresa will find ways to make sure that our staff are on top of everything and deliver the vaccine.
Thank you.
Any further questions from AM 800?
Yeah, I have one. Dr. Ahmed, we are hearing from teachers that in some cases, COVID cases from their classroom are not being considered school cases, and therefore cohorts are not being sent home or notices provided to the community. Do you have any comments on that?
So I think the key distinction is not necessarily if the cases are acquired where, because even if the cases are acquired, outside of the school environment, if they attended the school during their infectious period, cohorts will be dismissed. If they never attended the school during their period of infectiousness, and if they acquired the disease outside, there will not be any impact on the cohorts. And same idea, if someone attended and if there's any transmission that happened in the school, then obviously it's a much bigger discussion in terms of whether it's just limited to one class or it's written while other class. It does go through some outbreak investigation, because any transmission in the school setting will constitute an outbreak, and then that requires further investigation to assess the true impact of the spread, and then to put some control measures in place.
Okay, and then I guess for Bagley, the school is reopening on Wednesday. I guess for you and Teresa and your team, why did you figure now was the time to reopen the school? With the holidays approaching, wouldn't it make more sense to leave them maybe for virtual learning instead of welcoming them back to the classroom?
Well, Rob, that's a good question, but I think again, I touched on this topic last week as well, that when I am looking at the risk based on the exposures and the dismissal of the cohorts as a result of an outbreak, it's focused based on what is the immediate risk and what is the long-term risk that we can prevent. So all of those work that we have already done, and we have taken the step to mitigate any immediate risk and ongoing concerns. We put out some recommendations to the school board as well, that how they can continue to keep their cohort safe. But obviously, the question that you're asking about the switching it all to online learning, and even just the question that goes beyond Bagley but overall system in general, there are pros and cons to both the approach, and our Ministry of Education obviously is the lead in ensuring the safety of these school system and providing recommendations and guidance in that setting. So we hope that they are looking at everything that's happening not only in Windsor-Essex but across the other region. We do have lots of evidence in terms of even finding the benefit of in-person versus online learning. Some like it, some don't. Personally, I think I do feel that some of these decisions parents need to make that decision for their own children in terms of whether their own children are able to do the online learning versus not. So I think the question that you're asking it goes beyond me, and I would look to the Ministry of Education to make that call, especially if it's a much bigger system-wide discussion and not necessarily linked to any specific outbreaks or any immediate risk to the school.
Okay, thank you. Sorry, one more here. Just for clarification, I know CBC mentioned it when it comes to the statuses. So as of today, we're red, but if the numbers keep on fluctuating, we were 80 in the 80s on Saturday, 40s yesterday, 60s today. And I just want to get clarification. When you talk to the province this week, will you be advising them that maybe it's time Windsor-Essex goes into a lockdown?
Well, I guess we still have a few more days to look at. We start some of these discussions Tuesday, Wednesday, after looking at our data. So we'll look at our data, and again, case counts is just one of the indicator. Obviously, there are other indicators. Again, what is happening in the outbreak scenarios, or how many outbreaks that we are dealing with, the staff capacity, the percent positivity. So we will look at all those numbers, and we'll have that conversation and see where this conversation goes.
Okay, thank you. Have a good day.
Any further questions from CBC?
Yeah, I just have a quick question about the schools reopening, Bagley and Langlois. I know you mentioned that you have put out recommendations to the school board about how to continue to keep everybody safe, but I'm wondering if there's anything specific you can point to that is perhaps being done differently this time around to prevent another outbreak.
Well, I think a lot of those measures that is out there, we issued our toolkit for the school. We covered many of those recommendations there. And again, a lot of those recommendations are linked to people actually following that. And what we have noticed even from the beginning of the school year, at the beginning, I think there was a lot of anxiety, there was a lot of attention that everyone was paying, not only the teachers and the staff, but also the students. They were all very, very compliant in following everything that we asked them to do, which was great. But now, maybe because of their experiences or not contracting any themselves, not contracting the virus themselves, people are being complacent. People are not following what they should. So we do feel that a lot of that goes back to the actual human part when people actually have to follow it. The system that are in place that we have put together in our toolkit, I think it continues to provide all those recommendations, which is still valid, and even with the investigation, that continues to stay valid. And we just need to make sure that we have some policies and procedures in place to ensure that they are being implemented.
So if you're finding that people aren't being or are being complacent and aren't always following the regulations in the school system, are there any avenues to issue fines, things like that, in a school setting, like you would in a business?
Well, the Ministry of Labor did some visits to the school environment as well. So because it is a workplace, and the Ministry of Labor did some investigation, some education enforcement blitz in the school setting. And obviously, the school board also, work with the Ministry of Education and provide some and Ministry of Labor to provide that from a staffing perspective. But as far as the children themselves, how they are behaving in a cohort, in a classroom, I think that's more difficult to enforce. And they are children. We have to do a better education on them. And again, the education starts from home. What we are teaching our kids at school, at home, that's what they are taking it back into their classroom, and this is what they will do in the classroom.
Okay, thank you so much.
Any further questions from Blackburn?
No, thank you.
Any further questions from Windsor Star?
Yes, back to the weekend enforcement blitz. You said there's roughly 80% compliance. That means about 20% were not complying in some way. Can you comment on that number? It seems like, although it's a minority, still a significant number of the businesses that you visited were in some way not doing what they needed to be doing.
So we will get a report, and I believe the province is going to do a media release related to the compliance inspections and the joint inspections. Just this morning, they provided a little bit of an overview, but without giving all of the details. They did say that hopefully by Wednesday, they'd be able to provide more specific details.
Is there any comment from your perspective on just the need for businesses to do everything they need to do?
Well, our tobacco and vaping enforcement officers and our public health inspectors have been receiving complaints and doing complaint inspections and also compliance inspections throughout this entire pandemic. So of course we want businesses to comply, and from what we were seeing earlier on, masking or the not wearing a mask seemed to be one of the issues, where I see now in the report that screening and not having a safety plan and physical distancing were the primary issues. So physical distancing and masking had always been what we were observing. So maybe the masking isn't as much of an issue anymore, but physical distancing has and continues to be an issue. And I think that's probably what we'll hear in their report, or more information about that. And in conjunction with our health unit, we did prioritize some of the the visits or the workplaces based on the number of complaints we were seeing. So they did start with big box stores, and then also some restaurants. So we look forward to the report as well. We want to see exactly what they found.
Okay, thank you.
Thank you, everyone.
Thank you.